Good evening, everyone, and welcome to Cultivating Mind-Body Wellness in Dental School, Tools for Stress Management and Personal and Professional Development. Tonight's webinar is a presentation of the American Student Dental Association, and I'd like to start with some instructions and introductions. My name is Kasia Halko, and I'm the facilitator of tonight's program. I'm Asda's marketing manager and one of 13 staff that work for Asda. Tonight's presenter is Dr. Christina Pastan. This webinar is a presentation of Asda's Wellness Initiative. The goal of the initiative is to equip Asda members with a variety of resources related to overall wellness, including 5 dimensions in particular: emotional, physical, environmental, occupational, and intellectual. You'll find resources for each of these, as well as links to the wellness centers at your dental school on Asda's website. This September, Asda is also celebrating Wellness Month, where members and chapters put a special focus on dental student well-being. You can find wellness content on Asda's blog each week, as well as on our social media channels. At this time, we'd like to recognize the exclusive sponsor of Asda's Wellness Initiative. ADA Members Insurance Plans, underwritten by Great West Financial, is committed to your emotional, physical, and financial wellness. That's why they offer disability and life insurance at no cost to ADA student members while you're in dental school. It's easy to request activation of your no-cost coverage today at insurance.ada.org/healthy. And now I'd like to introduce tonight's presenter. Dr. Christina Pastan is an assistant clinical professor in the Department of Endodontics and the director of Mind-Body Wellness at Tufts University School of Dental Medicine. Dr. Pastan graduated from Tufts in 1991 and earned her certificate in endodontics from the Tufts PG Endodontics program in 1994. In addition to her private practice in Boston, she has been a volunteer clinical instructor in the Department of Endodontics at Tufts for the past 25 years. In July of 2015, she became the school's first director of Mind-Body Wellness. A longtime practitioner of yoga and meditation, Dr. Pastan began teaching self-regulation breathing skills to her endodontics residents, and as a result, pursued a professional training in yoga and meditation from the Kripalu Center for Yoga and Health in Stockbridge, where she earned a 300-hour certificate in yoga and meditation, as well as a 25-hour certificate in Lakshmi Volkar chair yoga. And now I'd like to welcome Dr. Pastan to the program. Welcome. Join us, please.
Good evening. Good evening, dental students all over the country. I want to thank Asda for inviting me to do this webinar and share with you my work, the work that I've developed here at Tufts with all of you. That's really become my passion now in dental education. So many of you might be wondering, what is the director of Mind-Body Wellness and why would a dental school need one? Well, as Kasia was saying in her introduction tonight, I started teaching my endodontic residents yogic breathing because I was finding when I was a clinical instructor in the PG endodontic clinic, a lot of my residents were having anxiety issues when they were involved in their difficult endodontic procedures. And it was one in particular that really catapulted me into this work that I'm doing. I had a student who experienced a panic attack before her first apicoectomy. And the student had no awareness that she was having a panic attack. And it was when she started to drop all of her instruments out of her cassette onto the floor that I looked at this student and I said to her, I am not able to let you do this surgery if you cannot find a way to ground yourself and get focused on this procedure you're about to do. Would you be willing to let me teach you a breathing technique that I've practiced in my yogic practice, a technique that not only do I use in yoga, but use when I'm in the midst of a difficult endodontic procedure. And she agreed. And I began to teach her a classic 3-part breath of yoga. And I didn't know what else to do in this situation, because I felt that I needed to make her aware, first and foremost, but then to give her a skill, a tool to cope, because this was a student in her 7th year of dental education who didn't understand that she was not in the right frame of mind and body to do the surgery. So I taught her the breathing technique. She got another cassette. She did her surgery. She did a great job. But it was what she said to me after. And she told me that I, first and foremost, was an instructor, a faculty member that looked at her as a human being in struggle and not as a dental student that needed to get a procedure done. And that I might have just taught her the most important skill that she had learned in dental school or maybe in her life. And as I just said, this is a student in her 7th year of dental education. And I was so taken by that, because I thought, wow, if this student doesn't have the awareness to know how to cope in a stressful situation, what about all the other students in that school? What about the 1st-year students that are coming in, and high volume learning is becoming a challenge right away? And then the 2nd-year students who are seeing their first patients, and the 3rd-year students dealing with the beginning of competencies, and the 4th-year students with managing that and licensing exams. So that is what inspired me to get certified in yoga and to teach this formally at our school. So when I think about us here at Tufts incorporating mind-body wellness into dental education, I didn't make this up, right? This concept is not new. And when we go back to the ADA's first code of ethics that was written in 1866, it states that the dentist should be temperate in all things, keeping mind and body in best possible health, that their patients may have the benefit of that clearness of judgment and skill which is their right. Now, I certainly don't know if the person who wrote that all those years ago was thinking of mind-body practices, but they were certainly focused on the fact that dentists need to be centered and grounded within themselves in order to best serve their patients. And when I think of my student that day, and I think of her doing her first apicoectomy in the state she was in, that certainly wouldn't have been fair to her patient, and I don't think that it would have best served that patient for the patient to have experienced her in that place. So let's look at the 4-year journey of the dental student. The journey begins with the transition from college or from whatever program or job the student has come from and is now engaged in high volume learning, cultivating the hand skills to practice dental procedures. And that can be extremely overwhelming, especially when the student may now be coming from a new city. They may not have any family around. They're not used to the support that they may have had before. Exam blocks are frequent and involve several exams over a short period of time. Then competencies immediately begin in pre-clin, and students are now faced with the possibilities of failure and feeling doubtful in themselves when that happens. And then 2nd year begins and the students begin to see their first patients, which can be overwhelming to begin practicing procedures that they've been doing on in pre-clin, on dummies, and now on their patients. And then the 3rd year is all about managing your patients and getting efficient and proficient with your skills, managing your own little practice, trying to get your requirements done. And then fourth year is a continuation of that, but now it's involving the licensing exams, applying to PG programs, and finding jobs. So we all know that dentistry is considered one of the highest, most stressful professions. And so think about what I just said. The stress of dentistry begins in dental school. And those stresses don't change. They just morph into different types of stresses, and then real life stress comes into that. So the stresses in dentistry that begin in dental school are technical, they are psychological, and they're physical. So dental students are trying to learn these technical skills. Many students have not engaged in manual dexterity skills, and so it could be a steep learning curve for them. Then once you start seeing patients, you have the psychological component of dealing with different personalities, fearful patients, and the difficulty also with yourself psychology and self-doubt, or if things don't go well, being hard on yourself. And then we have the physical stress. And dentistry is really difficult on our bodies. It closes down our chest. It affects our back, our lower back, our neck, our shoulders. So it's important that dental students get a grasp on dental stress early on. So when we go back to the story of my resident, it's important to think about managing stress as a way of developing your professionalism. And so awareness and the ability to manage stress go hand in hand with developing yourself as a professional. And I felt in that moment, the student who I'd worked with for a year, who was highly competent, extremely skilled, in that moment was not her most professional self. So cultivation of awareness is a hard thing to get your head wrapped around, especially in the world that we live in today. So we are constantly challenged by distractions, and it takes deliberate practice and skill to navigate through the stress of life and not get caught up with technology and what I like to call the technology tornado. And so everywhere we go now, technology is pulling us away from the present moment. And sadly, we are becoming a society that's losing connection to ourselves as human beings, to the natural, beautiful world that we live in, and to life itself. And we are faced with a digital dilemma, right? We're constantly connected to social media, to emails, to texting. And, you know, these certainly have their place, but there are limits. And being present today is a choice. And with life's challenges and distractions, it's really difficult to be present and to be aware. And that is what I saw that day with my resident. She didn't understand that. And I feel that getting her to breathe and getting her to connect with herself, just to feel herself as a human being and to use her own natural resource, her breath, to calm herself down, that was very profound to me. And what really has made me passionate about this is because if we can't connect with ourselves as human beings, as healthcare providers, how can we connect with others, right? And basically, you're all in dental school to treat other people, right? You're training to become doctors, to be dental healthcare professionals, to make a difference in people's lives. And as we all know, we all love our dentists, right? You will probably become somebody in your patient's life that is endearing to them, right? People always say, "I love my dentist," and that's what you're trying to cultivate in your development as a professional. But without the skills of that within yourself, it's hard to do that with others. So when we get ourselves in a place of being present and focused, we become consciously aware and we interact with the world very differently. When we get to that place, we are more graceful, we are more skillful in our actions, we are better communicators, better listeners, more patient, and we have the ability to pause and wait before reacting or deciding. And so everything I mentioned, I feel, are essential qualities that I would want my healthcare provider to have. And mind-body practices, especially yoga and meditation, are ancient practices. They might be getting quite a bit of press these days, and one could argue that maybe they're fads, but they've been around for over 5,000 years, and they are grounded in evidence-based scientific research. These practices are self-regulating physical and mental practices that were actually created to help people navigate their lives. Right? They're physical and mental practices that were created to help people cope with life and basically rise to the highest occasion in whatever they were doing. And again, as I say, they're practices that cultivate awareness and rein us in to the present moment. So let's look at yoga first. Yoga consists of an 8-limbed pathway that begins with moral and ethical observances and restraints. It encompasses physical practice, breathing practice, the ability to withdraw from external stimuli and focus inward, meditation, which is a limb of yoga, and the experience of oneness. So yoga is so much more than downward facing dog and exercising on a mat. And as my teachers from Kripalu have taught me, is that yoga is about skillful participation and engagement with life. And that leadership is more than a job or a profession, but about taking responsibility for every moment of every breath, of every second, of every day. And when we do that, we can reach our greatest potential. And this is the basis of the work that I do with our students at Tufts and in my passion. So what I just talked about, okay, is 8-limbed path of yoga that talks about moral and ethical observances and restraints, breathing practice, the ability to withdraw from external stimuli, focus inward, right? A feeling of oneness. This is what I helped my resident reel in that day, which allowed her to perform at her highest skill level. And so basically our students, when they come into Tufts now, are getting this grounding through mind-body practices as part of their education, because we feel that part of their development as professionals is to cultivate the qualities and the skills to be in this place, to be a consummate professional. So I'd like to actually take a pause here and guide a short experience, a centering experience, which I like to refer to as a mind-body call to order. And we're going to begin right now with that experience. So I'm going to ask all of you participants, wherever you are in your homes, to close your eyes and find yourselves in a comfortable seat. And feel your feet grounded into the earth. And place one hand on your heart and one hand on your belly and connect with the physical body. And just notice how the body is feeling tonight after a day of dental school, after a day of sitting at your desks or maybe seeing patients or both perhaps. And wherever there might be an area of tension, invite softness into that place. And now connect with the breath. And just begin to notice the breath as it comes in and out of the body. Notice when you breathe in how the chest rises. And when you exhale, how the chest lowers. Just with your hands on your body, feeling the connection of breath and body. Now, the breath and the body are always in the present moment, but the mind rarely is. So using the breath as an anchor, with every exhale, use the breath to tether the mind into the body. And so breathing in and breathing out and feeling the mind connected with the breath and the body. Breathing in, breathing out, feeling breath, mind, and body stacked on each other like blocks. And when you're ready, open your eyes and take a moment of pause to notice how you feel. Notice if there's been a shift in how you're feeling. Notice if you felt any sensations in the body, any tingling, any feelings of relaxation, and maybe also notice the state of the mind. And so what just happened in that moment was that you all practiced yoga. And you might be wondering, how did we just practice yoga? We didn't move, we weren't on the ground, we weren't in yoga clothes. Well, the word yoga is derived from the Sanskrit word yuj, which means to join together or yoke. And so when I think of the word yoke, I think of the visual of two oxen, yoking two oxen. And whenever we join anything together, join any force together, whenever we collaborate or cooperate, we get a more powerful result. And so when we joined mind, body, and breath, we have a more powerful self. And so practicing yoga doesn't mean that you have to get on a mat. It could mean just taking a moment at the beginning of your day to sit in a chair, to connect with the physical body, to connect with the breath, to quiet the mind, and center yourself before you start your day. Or as I do when I come into my office in the morning, I center myself before I leave the house. I center myself again when I'm in my back office, and many times during the day. So a very small practice like that could be very helpful in your day. Now, research has explored how yoga supports self-regulation, not only as a physical practice, but from its historical roots. So what is self-regulation? Self-regulation is our ability to be able to manage and control our behavior, emotions, and thoughts and alter them in accordance to the situation. So my resident in that moment did not have the skills to self-regulate. She wasn't able to manage her behavior. She was having an anxiety attack. She was panicking, so her emotions were not regulated, and she didn't know how to alter them in accordance to the situation. What she realized after, when she thanked me for teaching her a skill to cope, is that, and we didn't even talk about self-regulation in that exchange, she just knew that now she knew how to use a tool to help her cope and prepare herself for the task she needed to get done. And that might not be an apicoectomy. It could be an amalgam. It could be honestly, an intake with a very difficult, anxious patient. It could be anything. It could be something you might even use in traffic. It doesn't matter. You can use this skill in many different ways. So, as I said, research has explored how yoga supports self-regulation, not only as a physical practice, but from its historical roots. And yoga incorporates breathing skills, it incorporates meditation, and teachings beyond physical postures, that the ethical observances that we learn in yoga as well, non-judgment, self-compassion. And so these skills provide top-down tools, or tools that impact the mind, as well as bottom-up tools, which are tools that impact the body. And this synergistic effect that is unique to this ancient practice is what creates the impact. So let's look at meditation, okay, which is a limb of yoga. Meditation is not a standalone, it's under the yogic umbrella. And meditation helps us stay present to our breath. When we do that, we experience different sensations going on in the body. And this practice helps mediate rumination. It helps improve our ability to manage emotions and anxiety and increase our self-compassion. And so when we're sitting there with ourselves breathing and meditating, we're allowing ourselves to just be human beings, to just exist, right? We're human beings, we're not human doings, and we rarely allow ourselves the time to just be. And when we can allow ourselves to be with non-judgment and self-compassion to whatever's going on in our minds, right, we are able to increase our self-compassion for ourselves, and we're able to increase our awareness of our own beings. And so yoga and breathing practices impact the body by sending messages to the mind that it's okay to relax. And so when we breathe and move with awareness, something changes mentally, even when you're not consciously trying to change thought or emotion. And these practices impact our physiology directly by improving the function of the vagus nerve, which helps us calm down and relax. And so the outcome of these practices is that moving the body and consciously breathing allows us to respond to life with less stress and discernment, and ultimately cultivates, the more you do this, it cultivates resilience and self-regulation. So teaching these tools to our dental students through these practices begins in their first year of their training, and it allows them to develop skills to cope with their academic stress that they incur immediately. But then they use these techniques over their 4 years and will bring them into their lives after dental school. So I always say to my students, I can't make you an endodontist, and I can't make you a yogi or a meditator. But what I can do is, by educating you on what mind-body practices have to offer for us physiologically. It doesn't mean you have to go to yoga classes. It doesn't mean you have to be a meditator, but to just sit in a chair for 3 minutes and breathe and relax and feel your own being. Over time, we'll cultivate that resilience and self-regulation. And I can't think of a better tool to have in my toolbox as an endodontist who has a very stressful practice. There isn't one day that I come into my office that isn't stressful, but I feel always at the top of my game because I'm able to utilize these practices to help me in my practice. So I did something interesting with our incoming class during orientation this year on their first 2 days of school using a polling app. And I asked them, what words come to mind when you hear the words yoga and meditation? And so they all typed in these words and a big word cloud appeared. And I wanted to share with you some of the words that they wrote. So what are the words that come to mind when you hear the words yoga and meditation? So the words were calm, balance, relax, control, clarify, and focus. And these are great words to describe yoga and meditation, but if I had to think of a list of words that I would want to describe the doctor working on me, they would pretty much be the same. I would want my doctor to be calm and balanced and relaxed, in control, and to have clarity and focus. And so mind-body practices go hand in hand with professionalism, and that is the context that I'm teaching yoga and meditation to our dental students. Because when we think about the professional process, right, it's one we make a commitment to stay engaged in. And developing ourselves as a professional involves developing the qualities of self-awareness, acceptance, wisdom, compassion, and commitment to self-care. These qualities we also cultivate when we're on our yoga mat, right? Accepting our bodies for what they are and what they can do, right? Being wise and skillful in our actions. When we can be wise and the way that we think, the way that we move, we can be wise out in the world. How can we have compassion for others if we don't have it for ourselves? And when we sit quietly with ourselves and cultivate self-awareness in ourselves, we will see the world in a different place and have much more awareness in our lives and in our practice. And all of this comes down to self-care. Yoga and meditation are practices of self-care, and we need to self-care as healthcare professionals and not feel guilty about it. So the bottom line is our character, our conduct, the way our colleagues and our patients perceive us is what establishes us as a professional. So cultivating ways to be grounded in this way are only going to make us appear and feel more professional. So how can mind-body practices help you as a dental student? Well, they are ways of easing academic stress. They are practices that calm the body and the nervous system. They are practices that slow down life when it's moving too fast. They can provide respite from mental overload. They can help you focus. Right? These practices have been grounded in research, especially meditation, to help focus. You need to be attentive in lectures, in communication and listening with your teachers and your peers, to be mindful and present. As I said, self-regulation. Developing self-regulation from the beginning of first year, to be able to come into an exam, your first exams in dental school, to come into the cadaver lab and be able to use your breath to stay calm. That's only going to help you when you see your first patient. when you get into difficult procedures. Self-awareness. I can't say it enough. Without self-awareness, we can't grow as people, we can't grow as professionals, and we need that within ourselves to be aware of others. Mind-body practices can help us with clinical stress, right? That ability to calm ourselves down when things get hard in dental school. And then again, self-connection. When we can feel connected to our human self, our being, and be at peace within ourselves, we will be really able to connect with our patients on a much deeper level. So I would like now to introduce you to the first of 3 students who will be joining us tonight to share their journey with mind-body professionalism through dental school. And I'd like to first ask Sarush Samimi to join us. Sarush is a 4th-year dental student here at Tufts. He's from Atlanta, Georgia. And Sarush, thank you for joining us tonight.
Good evening. I'd like to thank Dr. Pastan for inviting me and the rest of the students along on this panel, and thank you to the audience for tuning in tonight. So I'd like to discuss my personal experience with the program that Dr. Pastan has initiated and founded at our school. Starting with the past, how it all started for me is that the first year of dental school, rather a transition for most people, I found myself in a difficult personal circumstance along with everything else that you're responsible for with school and grades and everything. So I sort of turned my attention into a 30-minute yoga or a 30-minute meditation session during lunch, randomly dropped in, not knowing what to expect and how it was going to affect me. I found myself feeling what we felt after the 3 minutes, that tingling, that sense of awareness, and I wanted more of it. So I went to a yoga session that we had a couple weeks later on. It was in the evening, and it started to grow on me. It was rather added to my utility box as a new way to deal with personal circumstances, personal challenges, and to prioritize how to deal with it when you have all these other responsibilities going on. Turning our attention to the present, being a 4th-year dental student, applying for PG programs and pursuing a career in oral maxillofacial surgery, a lot of expectations are there. How to deal with the expectations, with the responsibilities, it's best to deal with them with a clear mind and to prioritize the important things and to really be able to access everything that you have, the knowledge that you have in your mind. And that's only done with self-awareness. People have different ways of dealing with that. People have different ways of coping with stress, but this adds a new tool to how you can accomplish that. And how I see this affecting my future is being open to new things. And I think the goal tonight is not to become a yogi, is not to force anyone to join a class or join a club, but to rather keep an open mind to how you can deal with circumstances and situations in your life. And if there's one quote that I can leave everyone with is the moment you are done changing, you are done. And I encourage everyone to try something new, whether it be mind and body wellness or another tool and instrument to really become self-aware and in touch with themselves. So thank you all, and we'll go to the next student. Thanks, Dr. Pastan.
You're welcome. Now I'd like to invite Rishi Busari to join us.
Hello.
Rishi is from Bow, New Hampshire. He is a 3rd-year student here at Tufts.
Hi, everyone. First of all, thank you, Dr. Pastan, for having me. And thank you all to the audience for tuning in as well. So my name is Rishi. I'm a 3rd-year student here at the school. And my mind and body wellness journey really started during my interview here, actually. Way back 3 years ago now. I can't believe it's already passed. But what really drew me to the school was the energy of all the students that came up to me during my interview and were offering advice on how to answer all my questions that were asked to me, and also the fact that Dr. Pastan had her yoga and mind-body wellness program here at the school, which wasn't offered at other schools that I interviewed at, and that was definitely something that struck me about the school and pulled me to come to Tufts School of Dental Medicine. After that first year, I academically had a tough time transitioning to dental school from undergrad, and that required a lot of self-regulation, self-reflection, to really figure out the areas that I was weak in and how I can strengthen those. And through that, I had to develop some strategies to figure out how I was going to go from there. And with the support of Dr. Pastan and her 15-minute meditations during the lunch hour, I was really able to de-stress and focus on the task at hand. And over the years, going to those 15-20-minute meditation sessions during lunch, it's really helped me center myself and focus myself, and it's been crucial in the clinic now, because when you're stressed, when you're thinking about 20 different things, it's so easy to forget which tooth you could be working on. You could be working on a number 6 and all of a sudden be drilling into a number 7 or number 5. So before each of my appointments, especially operative, before I even pick up the drill, I take about 30 seconds to a minute to just sit down before the patient even gets in the chair and think, what am I going to be doing? Visualize, what am I going to be doing? Take a couple deep breaths and center myself before I even start working, because that's a mistake I don't want to make. And not handling your stress when we're really stressed with life and dental school, mistakes happen. So it's very important, especially as caregivers, to center ourselves, make sure we have our stress under control so we can give quality care to our patients. And that's something that through mind and body wellness and the support of Dr. Pastan, I've really been able to get better at, and I hope to continue doing so.
That's great. Thank you, Rishi.
Thank you.
And our last student is Sophie Hight Miller from Baltimore, Maryland. Sophie is a second-year student here at Tufts.
Yes, so thank you, Dr. Pastan, for having us. Like they said, we all had the wellness curriculum when we first started our first year. Fortunately, I was involved in wellness before I started at dental school, but when I got to dental school and with the wellness curriculum, Dr. Pastan taught us not only about wellness in general, but wellness as a dental student, because like she was saying, and like I'm sure all of you are experiencing, dental school is a different type of environment. It's very unique. It's high level of learning, high volume of learning, and we have competencies that we've never experienced before, and we're starting to work on patients. So it was really unique in the fact that she taught us not only mind-body wellness in general, but also how it can apply to dental students and to dental school in general, and how we can utilize that later on in our professions. So she's made it really accessible for the dental students to take yoga class and meditation during lunch, and has created a space for people who have never experienced wellness to try it out for the first time in a non-judgmental environment. And we are all very fortunate to have Dr. Pastan here at Tufts Dental, but again, like, don't let that limit you to giving it a shot. Giving it your own shot at trying it out. There are a ton of resources out there these days. But mind body wellness has taught me to really stay calm and focused during exams. It's really easy as a dental student, first year, to compare yourself to other people and to be judgmental on how you do on an exam, but it's taught me to not dwell on missing a question or two, and because we set really high standards for ourselves. But mind body wellness has taught me to stay calm and to not be judgmental on myself, and I think this is going to help me in the clinic, and because not everything is going to go well all the time, not everything's going to go to plan, but the best part about mind body wellness is to stay calm internally and stay grounded even when the space around you seems chaotic and crazy. And and the best advice that Dr. Pastan has taught me early on is to just take each day by day. When we think about how much we learn and how much we do in dental school, it can be very overwhelming. So the best part is to take each day and to not be afraid to carve out some time for yourself, even if it's 30 minutes, because it's more beneficial than it would be to cram an extra 15 minutes of studying or spend that 10 minutes on social media. So I think this will make me a better professional in the future as things progress. So thank you, Dr. Pastan.
You are welcome. Thank you guys for being here. So what I really enjoy seeing through Asda and all the readings that I see is that many dental schools around the country are really beginning to focus now on wellness, on student wellness in many different capacities. And I really applaud all of the schools and all of the students that are making this a priority at your dental schools. And we here at Tufts have, as I said, I am a director of Mind Body Wellness. But at a lot of schools, I feel that there are a lot of programs that are trying to get off the ground, trying to create more programs for their students. And I would like to say, I'd like to encourage all of you who are listening, who have this passion, who want more of this at your dental schools, to talk with your administration and find more ways to bring wellness in. But wellness from my perspective and in the place that I come from isn't just about eating well and sleeping well and exercising. Mine is I really believe in the whole concept of calming your mind and connecting to the self. So I feel that is extremely important to coping as a student, but also then coping when you leave dental school. Because as I say to my students, my life, even though I've been out of dental school for over 25 years, is no less stressful than theirs. I just have different stresses than they do. And I am constantly in my practices as a way to cope, as a way to deal. And even 25 years of practicing endodontics, not every root canal is a cinch. And I don't know where I'd be on some days without the utilization of my breath. So I would encourage you to think about just stopping and breathing, maybe loading a meditation app on your phone. If you don't want to go to a studio and do yoga, there's so many apps and websites where you could just do 15 minutes of yoga in your bedroom. So just taking the time every day for some quiet, giving yourself a break from your phone, a break from Instagram, a break from Facebook, a break from your computer. I mean, even if you just did something like that, it would make a big difference in your life. So without a sound mind, we can't have a sound body, and without a sound body, we will not have a sound mind. They are interconnected. So that is how I'm going to end my time with all of you. I believe that we're saving the last 10 minutes for questions and answers, and I invite you to share any of your questions with me.
Thank you thank you, Dr. Pastan, for that presentation. I'd also like to thank Sarush and Rishi and Sophie for sharing their personal stories. And now I'd like to invite those of you who are on the line who have questions to go ahead and type them into the chat box that's on the right side of your screen. You can type your question there, and I will ask Dr. Pastan your question. First of all, Claudia wants to say thank you very much. She thought the presentation was very valuable, so thank you from her. One question that comes up here is, what happens if you're not good at meditating and you find that you can't still your mind, that you're distracted, that you like your brain runs away with a bunch of different things? How do you clear your mind and focus and meditate without distraction?
Well, first of all, you can't be bad at meditating. Anyone who sits and does it is good at meditating. Right? There's no such thing as a bad meditator. And meditation isn't about stopping the mind or clearing the mind. It's, I'm actually going to grab my snow globe right now because you guys can see me. So this is a visual I often use in my meditation classes, okay? So this is our mind, right? It's a snow globe. And so in that snow globe are thoughts, feelings, and emotions. And we as human beings have thoughts, feelings, and emotions. Right? An empty mind or a stagnant mind is not a living human mind. So the whole idea with meditation is to, even if it's only 3 minutes, to be able to just sit quietly with your eyes closed or eyes open and just, I am breathing in, I am breathing out. So look what happens to the snow globe. Right? I am breathing in, I am breathing out. When you just focus on your breath, in those words, the thoughts, feelings, and emotions don't go away. They just settle down. And that's what and they don't stop, right? They're still in there moving it some way. So what meditation is about is becoming cool with your mind in whatever way it is, and allowing those thoughts, feelings, and emotions to just maybe settle. Or if they stay like this, if you can't get your mind to do that, to just be like, okay, this is what my mind looks like today. I am breathing in, I am breathing out. My mind is a blizzard, but there's nothing I can do about it. Just being able to do that, when you open your eyes and being able to accept this crazy mind with non-judgment and self-compassion, you do more for yourself than you actually think. So it's a practice, and it's not something that you're going to master. Some days it's good, it's bad. It's trying it and accepting whatever the mind is. And maybe some days you'll feel that the mind is settling more. And maybe some days it isn't, but it's about being with whatever way the mind presents.
Thank you. The next question concerns the apps that you talked about, or video programs, or like videos on YouTube. Do you have a specific app, one or two, that you like to recommend the best?
My favorite app for meditation is one called Insight Timer. It's a free app. And what I like about this app is it allows you to set a timer. And so if you want to be, I'm just going to start you easy. Let's say you just want to do 2 minutes and see if you could do that, or 3 minutes. It will give you a 5-minute countdown. You have your 3 minutes, and then it tracks you. So if you want to really start a meditation practice, you get a star for every day that you meditate in a row. And then once you do 10 days, you get a star. And it's a way to stay motivated. They also have some of the best guided meditations, and many of the teachers from Kripalu who have trained me are on this app. And there's a little menu. You can pick a 3-minute meditation, a 5-minute meditation, a 10, a body scan. It depends. If you can do that. I also will say that if you want to find me on SoundCloud, I created a SoundCloud for my dental students, and it is specifically for dental students. If you go on SoundCloud and put in Dr. Pastan, I have about 12 different meditations, one for pre-exam meditation. I have centerings, body scan, a standing meditation for clinical grounding. So that could also be a resource. But I would say that Insight Timer is by far my favorite app for meditation.
Wonderful, thank you. Our next question says, if you know that you failed or didn't do well on a test today, and you have another important test tomorrow, how do you compartmentalize that failure and focus on the next exam without letting the first one drag you down?
That's a really good question, and it's really that's very, very hard. And what I want to say is that that's part of dentistry. So I want you to think about that exam as you would when you are practicing dentistry for even 10 years and you perforate a tooth, or you do a periodontal surgery and it fails. You place an implant, it fails, right? It's important as long as you bring your best self to your exam, to your procedure. If it doesn't go well, that is life. There are some things that are not in control. And it is important to say, to let it go, as hard as it is, but to know that tomorrow is a new day, tomorrow is another exam, and that failure doesn't define you. Because we actually fail at many different things throughout our lives. But it's the ability to pick yourself up and to keep going forward and not be afraid to fail, because it's through the failures that we actually better ourselves and we learn so much.
Thank you. We have one last question. I'm going to put out a call for questions. We have one right now, and I'll read that one. If anybody has a last question, please type it in the box. Otherwise, this will be the last one for the evening. The question is, what's required to implement a mind-body wellness program at this person's institution? They're asking about if there's a certification they must complete, or can a group of students just come together and lead other students in practice?
I think that wellness programs at dental school need to be unique to their schools. And so where there's a will, there's a way. And so it could be a group of students who want to create a program at their school. If there is a faculty member that wants to, there really aren't any requirements. I thought, I felt it was important for me to I wanted to become certified in yoga because I wanted to teach it. You can't teach yoga without being certified in it. But I would just say that all it takes is an interest, a passion, and then you can create any program that you want. And it's exciting to think about, like, what would you want for your school? What is the personality of your school? What is the environment like? And will your environment accept it? You have to get the buy-in, and the passion is what cultivates the buy-in. So just if you think it, make it happen and make it yours.
Wonderful, thank you. So that completes the questions for this evening. I'd like to thank everybody who shared their thoughts or who had a question for Dr. Pastan tonight. Before we conclude, I'd like once again to thank tonight's sponsor, ADA Student Members Insurance Plans, underwritten by Great West Financial. Great West is the year-round sponsor of Asda's Wellness Initiative. And finally, I'd like to thank all of you for participating in tonight's program. In about an hour, you'll receive an email that has a link to a very short survey. Please take just 3 minutes to tell us what you thought about tonight and what other topics you'd like Asda to present about in the future. One person who completes the evaluation will be randomly selected to receive an Asda Wellness Prize. We've got some swag that we want to send you, so please complete the survey. Once again, thank you to everyone for participating, and have a great night.